Threadworms, also known as pinworms scientific name, Enterobus vermicularis, are a common type of parasitic worm that primarily infects the intestines, particularly in children. They are small, thin, and white, resembling threads, hence their name. While they are generally not serious health threats, they can cause discomfort and irritation, especially around the anal area. Overview. Transmission. Threadworms are highly contagious and spread easily, particularly in settings like schools and daycare centers. Infection occurs when eggs are ingested, often through contaminated hands or surfaces. Life cycle. The female threadworm lays eggs around the anus at night, leading to itching. Scratching can transfer the eggs to the hands, which can then contaminate bedding, clothing, and food. Symptoms. The most common symptoms of threadworm infection include itching, intense itching around the anus, particularly at night when the female lays her eggs. Restlessness, discomfort and sleep disturbances due to itching can lead to restlessness, especially in children. Irritability. Children may become irritable or moody due to the discomfort. Visible worms. In some cases, adult worms may be seen in the stool or around the anus, appearing as small, white threads. Secondary infections. Scratching the itchy area can lead to skin irritation or bacterial infections. Diagnosis. Diagnosing the threadworm infection typically involves medical history and symptoms, discussing symptoms and any recent exposure risks with a healthcare provider. Scotch tape test. This involves placing clear adhesive tape around the anal area, ideally in the morning before bathing, to collect any eggs. The tape can then be examined under a microscope. Visual examination. Healthcare provider may visually inspect the anal area for the presence of worms. Treatment. Treatment for threadworm infection is generally straightforward and may include medications, over-the-counter or prescription medications, such as mebendazole or pyrantelpamoate, are commonly used to eliminate the worms. Treatment may be given to all household members to prevent reinfection. Hygiene practices. Good hygiene is crucial in managing and preventing threadworm infections. Recommendations include washing hands thoroughly, especially after using the bathroom and before eating. Keeping fingernails short and clean to reduce the chance of transferring eggs. Washing bed linens, pajamas, and towels regularly in hot water to kill any eggs. Encouraging children to avoid scratching the anal area and to wash their hands frequently. Retreatment. Sometimes, a second dose of medication may be required after 2 weeks to ensure all worms and eggs are eliminated. Prevention. Preventing threadworm infections involves practicing good hygiene and cleanliness. Regular hand washing. Teach children the importance of washing their hands with soap and water, especially after using the toilet and before meals. Keep fingernails short. Trim children's nails to minimize the risk of egg transmission. Frequent cleaning. Regularly clean and disinfect surfaces, especially in shared spaces like bathrooms and kitchens. Avoid sharing personal items. Discourage sharing towels, clothing, or bedding, particularly in households with infected individuals. Conclusion. Threadworms are a common parasitic infection, particularly among children, but they can be effectively managed with proper treatment and hygiene practices. If you suspect that you or your child may have a threadworm infection, consult a healthcare provider for appropriate diagnosis and treatment options. By adopting good hygiene practices, you can significantly reduce the risk of infection and reinfection within your household.